The equipment is simple, inexpensive, and easily available. There are many types of needles available, some especially designed for thin needle aspiration biopsy. It is my experience that for most purposes, regular beveled hypodermic needles work very well. The range of size is generally 22 to 25 gauge. 23 gauge is my personal favorite and the needle I usually start with. Sometimes I choose a different gauge needle for specific reasons. For instance, if the 23 gauge needle meets great rubbery fibrous resistance in the tissue that makes it difficult to effectively move the needle tip through the tissue, I will switch to a 25 gauge needle. The thinner needle will move more easily and sample more areas in the tissue and therefore collect more cells. On the other hand, if the target has minimal amounts of stroma, like a lymphoma or a melanoma, a thicker 22 gauge needle would collect more material. In addition to the gauge of the needle, I need to choose the length. A short needle is easier to manipulate and does not bend as easily as a long one. Therefore, I will choose a needle that is just long enough to reach the target comfortably. Needles ranging from 5/8 of an inch to 1.5 inches are sufficient for most palpable targets. Longer needles are available for deep-seated targets. The needle should be connected tightly to the disposable syringe. I recommend a slip-top syringe because it is easy to handle and in my experience provides a good seal. The luer lock syringe may provide an even tighter seal, but disconnecting the needle is time-consuming and sometimes difficult. A syringe holder makes the procedure easier to perform by allowing a comfortable one-handed grip of the instrument, leaving the other hand free to stabilize the target. The holders come in different models and for different size syringes. Pick a holder that holds the syringe securely and that is comfortable to operate through the whole procedure. In general, a short distance between hand and target makes the procedure easier. Therefore, a smaller, shorter 10 rather than 20 milliliter syringe and holder are preferable. One might argue that a larger 20 milliliter syringe would be more effective because more suction can be applied. However, in my experience, a small amount of suction is sufficient, about 1 to 3 milliliters. Increasing the amount of suction does not appear to improve the harvest. The one advantage of a larger syringe is the greater capacity when emptying a large cystic space. A way of getting around this with a smaller syringe is simply to disconnect the filled syringe from the needle still placed in the lesion and replace it with an empty one. This maneuver is made easier if you have two guns available. In addition to the biopsy instrument, I need glass slides with one frosted end that can be labeled with a pencil. The smears may either be air-dried for Romanowski-type stains, such as May Greenwald Giemsa, or alcohol-fixed for Papa-Nicolau, or hematoxylin and eosin. For those slides that need to be fixed in alcohol, I have a jar. A Copland jar with its designed ridges will keep the slides nicely separated. If this is not available, I can use a plain jar and keep the slides apart by applying a paper clip to every other slide. Instead of immersing the slides in alcohol for fixation, I can use spray fixative. The advantage of spray fixation is that fewer cells will be lost compared to immersing. If I am by myself, by the time I have made the smear, placed the slide on the table, picked up the can, positioned it at the right angle and distance, and sprayed the smear, it will most likely be dry. It is crucial that the slides are sprayed immediately after smearing in order to avoid air drying artifact. This is best accomplished by having an assistant ready in position to spray the slides. In order to protect myself, I need a pair of well-fitting disposable gloves. It is not necessary to use sterile gloves for superficial targets. An alcohol swab is sufficient for cleaning the skin when sampling superficial lesions. A gauze pad is used to apply firm pressure after the sampling in order to prevent bruising. A Band-Aid will protect clothing from blood. A vacutainer tube is handy for extracting trapped material from the hub of the needle. I will show this technique later. Toluidine blue stain in a simple drop bottle can be used as a fast stain to assess the material before the patient is released. Application of this stain will be shown later. Air-dried slides can be stored and transported in plastic slide holders. If the slides are put in wet, there will be artifact from prolonged drying time. This artifact will appear even if the lid is left open. Just make sure the smears are completely dry before putting them in. The last item, but certainly not the least important one, is the requisition slip. It has space for all the usual information about the patient and the referring physician. In addition, there are pre-made drawings of various anatomic sites. Here, detailed information about the size, site, and clinical characteristics of the target can be indicated. There is also a space to record the consistency of the target when sampled and the nature of the harvest, for example, if it was cystic, necrotic, or exceedingly bloody. Local anesthesia is optional. If you wish to use it, apply buffered anesthetic with a small gauge needle. Suppliers for dentists have low-cost equipment available with needles as thin as 30 gauge.